সুপ্রিয় দর্শক সবাইকে সাদর আমন্ত্রণ প্ল্যানেটারি হেলথ একাডেমিয়া সুরক্ষায় প্রতিদিন অনুষ্ঠানে পাওয়ার্ড বাই ইউনাইটেড হসপিটাল। আপনাদের সঙ্গে আছি আমি ডাক্তার অমিতা হাসান। চ্যানেল 24 এর নিয়মিত আয়োজনে আমরা দেশ বিদেশের সাম্প্রতিক নানান বিষয় নিয়ে আলোচনা করে থাকি। আজকে আমরা আলোচনা করব বন্ধ্যাত্ব নিয়ে বা ইনফার্টিলিটি। আমরা জানি প্রতিটি বাবা মায়ের স্বপ্ন থাকে সন্তানের মুখ থেকে বাবা মা ডাকটি শোনার জন্য, কিন্তু আশঙ্কাজনক হারে এই বন্ধ্যাত্ব বা ইনফার্টিলিটি এখন বেড়েই চলছে। আমরা দেখতে পাচ্ছি যে সমাজের প্রায় প্রতি 6টি কাপলের মধ্যে একজন এই বন্ধ্যাত্বের শিকার হচ্ছেন এবং তাদের জন্য আসলে সেটি ভীষণ বেদনাদায়ক। একমাত্র তারাই বুঝতে পারেন এর কষ্টটি কী। তাই আমরা আজকের বিষয় নির্ধারণ করেছি বন্ধ্যাত্বের কারণ ও আধুনিক চিকিৎসা পদ্ধতি। আমাদের আজকের এই বিশেষ সেগমেন্টে আমাদের সাথে একজন বিশেষ অতিথি আমাদের সঙ্গে যুক্ত হচ্ছেন। আমি তার সঙ্গে পরিচয় করে দিচ্ছি, ডক্টর নির্মলা সাদাশিবম, ইনফার্টিলিটি অ্যান্ড আইভিএফ specialist, Chennai, India. Dr. Sadasivam, welcome you to our show.
Namaste.
Okay, I heard that you spent most of your years on research and working regarding this field in IVF, more than 30 years.
Yes.
So, can we want to know, tell us about how you will get interest on this field? How do you come in this field?
When I was finishing my school final, that is 1978, 1979, the first test tube baby of the universe was born in UK by Louis Brown, by Dr. Robert Edward, and a scientist and a clinician, Steptoe, Patrick Steptoe. So I was having an idea of going to medical college, then I had it in my mind, a great desire to go for an IVF specialist.
Yeah, and recently we heard that the rate of infertility is going up.
Yes.
Growing up. So can you tell us for the people what is the actually the infertility and what the causes behind this?
Yeah. Inability to conceive in a specified period, like 1.5 years after marriage, of living together is called infertility. Okay. Generally speaking, when I entered into this specialty in early 90s, it was around 3 to 5% as per the WHO's calculation statistically. Now it is around 15 to 20% globally, they say. And luckily or fortunately, in this part of the world, Bangladesh, among the South Asian countries, it is only 4 to 5%. We heard through the recent survey by WHO. It's a great news for you actually, but generally speaking, the highest infertility incidence is observed in South Africa. I mean, African parts like Niger and some part of Africa's. Now, the least possible infertility incidences are seen in Bangladesh and nearby countries. In India, they say around 10 to 15%.
That's great news. So we heard most of the time that female are most likely the cause. I mean, they are blamed mostly for the infertility.
They are blamed,
culture. Socially they are blamed. But male have some contribution on this.
Yes, 50-50.
So how do you define on this, right?
We can say 50% go to male and 50% generally to females. Because of the living conditions and the environmental pollution due to urbanization and more civilization in our style of life, and a lot of pesticides and fertilizers, insecticides we use in day-to-day life, more of chemicals than the plant material we use nowadays. 30 to 40% of our input into the body in a way of drinking water or juices or taking food, we are ingesting lot many chemicals. That may be that it has been proved that that is a major cause of infertility.
Infertility. So that is very important to know the people that chemical has some contribution on this.
In all our vegetables, fruits, food,
and the food
cereals,
dietary habits also.
Right, habits of lifestyle of people.
And how do you explain this matter? That's the people are careerist nowadays. They have some late marriage and they are taking time to take the baby. So does it actually intervene on this?
Yes, definitely, because 18 to 24 years is the great period of fertility. But 18 years, I don't think people are getting married
they are
nowadays.
not ready
Yes.
for this. Right.
So 18 years of marriage for a female is great, but even in India, we specify the government guidelines give you somewhere around 21 years of life you can get married, because to reduce the fertility, to reduce the population, actually speaking. But that is the reason, one of the reason, because for career sake, for education purpose, females are, women are delaying their marriage age. That may be one among the many reasons for infertility.
And actually, there is a period of time in case of female, their fertility period.
Yes.
Starting
during
from
menstrual
the
cycle.
Right, the cycle. So you said that the middle, I mean the initial stage is more preferable for taking.
You mean to say the cycle or years, their life?
Their life.
The life, yeah. 18 to 24 and roughly we can say up to 30 even, they are more fertile.
Okay.
They are more fertile. Once they delay the age of marriage after 30, their fecundity will come down. The nature of uterus to implant the embryo, I mean the amount of number of pregnancies after 30 are very less.
Very less. So tell us about the secondary infertility. Some actually couple have the one son or
that's again
baby,
comes with the age. Soon after the age, their frequency of sexual contacts will be more, and they will be young enough to be spend the time happily with the couple, I mean with the family. So they are having more opportunity for the first child immediately after marriage, or soon 1 year, 2 years within marriage. And after that they run here and there for studies and for earning for the family, and to keep up the family in a better way. They run around countries and different parts of the world. So they depart first of all. Second thing, living together is not possible for most of the couples due to their commitments to other parts of the life, other way to life. So the secondary infertility comes one way, in this way, social ways of getting in different stages and different places. Second thing, during the first pregnancy and delivery, they get into or exposed to infections, and the tubes are blocked, fallopian tubes are blocked. And for male equally, infectious diseases, they go for testicular inflammation, and their production of sperms are less, and the bad habits, smoking and alcohol, they also reduce the fertility profile.
Fertility care. Okay. So nowadays, in the previous days, we saw that if the couple are infertile, they are not trying for anymore. But nowadays, it's get the importance that they are go to the infertility specialist. They are going for some techniques and some parameters and under the treatment. So what is the reason for the recent advancement? I mean, why they are actually interested on this?
Because they come to know through other couples or through media that there are treatments, good treatments for this with better success rate. What were the success rates earlier? Generally, we can take even IVF. We are into this for more than 3 decades. And we can say in the earlier part of 90s, we were doing around 100 cases, you can get only 20-30 pregnancies, only 20 to 30% success rate with the conventional IVF. And later on, when days go, we used to harvest viable embryos. So the success rates become 70 to 80%.
Yeah, that's good.
That is the reason.
That is more. That's
it's
why
a shortcut. So people like to go for IVF, get more pregnancies.
More pregnancies.
In a shorter time.
So I have a basic question that when you declared a couple as an infertile, I mean, is there any criteria?
Yes.
How long they have to try for the children or any investigation, screening?
Yeah. Within 1 or 1 year, 1.5 years, they have to come for investigation or blood test and other investigations, test reports, because we have to identify the reason for infertility in a couple. Socially also, when they are forced by the family, we have to do certain basic blood investigations and tubal patency and the sperm counts of the husband.
Yeah,
these are all the basic
that is also
tests.
very important, because sometimes husbands are not willing to come to the doctor.
No, they have to come. We will make them count. Yeah, we will counsel them. Yeah, we will assure.
So that is the part of the screening and investigations. Okay. So what are the other techniques beside the IVF? For initially, when you diagnosed a couple as an infertile, so initially, actually, how do you start the treatment?
So basically, when the tubes of the wife, fallopian tubes are okay, patent and their husband's sperm counts are 20 to 40 million or within normal range,
Right.
they can be advised to have natural sexual intercourse in the time of ovulation. That is called
Okay.
natural assistance. And if they do not conceive, we go next to the basic treatment called intrauterine insemination. And then only IVF. The third stage is IVF.
IVF.
Yes.
So intrauterine insemination is the previous
Basic
technique.
treatment.
And it is it's a daycare
Yes,
process,
it's daycare
hope so.
procedure. They can have
Daycare.
medication, they come in the morning, they can go off in the afternoon.
So do you need to treat with some hormonal treatment before
Basically,
for the,
yeah,
any ovulation induction drug or
minimal
anything?
injections, minimal injections.
Minimal injections. Is that is a long process or
A matter of 14 days they will finish
14
that.
days?
Yes.
Oh, so they can
2
try.
weeks, yes.
Very nice to know. Okay. So we are going for the final pathway of the treatment, so which you are in a specialty and steamed in this field for long times.
Yeah.
And you have many researches on this. Your institution Genesis have some researches regarding this. So the IVF, what is the basic concept of IVF? When you actually consider a couple for the
IVF,
in vitro
yeah.
fertilization?
The IVF, in vitro fertilization and embryo transfer, is advised to the couple when they fail in the basic treatment like IUI, natural assisting cycles, and when they fail we can ask them to go for it after 3 to 6 cycles of IUI. That is the basic treatment called intrauterine insemination. In vitro fertilization will be advised first for couple whose wife has a blocked tube or bilateral tubal blocks and very few oocytes, that means eggs, that is we call them as premature ovarian failure, and a kind of male infertility where the count of sperms will be less than 10 million. So those candidates will go initially in the first attempt itself to IVF. Most of them come after 3 to 6 cycles of IUI. So this will cut short many years of infertility for them because it gives you more success rate.
Yeah.
Yes.
That's great. That's a good, I mean, parameter to consider them for the IVF. Yeah. So, Dr. Nirmala, we are going for a short break. We will be back definitely and a lot of discussion with you. সুপ্রিয় দর্শক, আমরা এতক্ষণ ডাক্তার নির্মলা সাদাশিবমের কাছ থেকে আমরা জানতে পারলাম যে এই ইনফার্টিলিটি বা বন্ধ্যাত্বের কিন্তু আধুনিক চিকিৎসা পদ্ধতি রয়েছে। যখন একটি দম্পতিকে ওনারা ইনফার্টাইল বা বন্ধ্যাত্বের শিকার বলে মনে করেন, তখন কিন্তু প্রাথমিকভাবে তার কিছু স্ক্রিনিং, কিছু চিকিৎসা পরে তারপরে তারা আইভিএফ বা টেস্ট টিউব, যেটি আসলে বহুল প্রচলিত, যে টেস্ট টিউব বেবি হিসেবে বেশি বহুল প্রচলিত, সেটির দিকে তারা ধীরে ধীরে এগোন। এবং আরেকটি মূল বিষয় হচ্ছে যে আমরা যে সমাজে যে বিষয়গুলো প্রচলিত ধারণা কিছু রয়েছে যে বন্ধ্যাত্বের জন্য বোধহয় নারীরাই বা ফিমেল পার্টনারই সবচেয়ে বেশি দায়ী, আসলে কিন্তু সেটি সব ক্ষেত্রে ঠিক নয়। সেক্ষেত্রে ওনার যে হাজব্যান্ড বা মেল পার্টনারটি রয়েছে তার সিমেন অ্যানালাইসিস করে সেখানে স্পার্মের কাউন্টটি কেমন রয়েছে সেটিও কিন্তু যথেষ্ট গুরুত্বপূর্ণ এবং তারও কিন্তু চিকিৎসা রয়েছে। All right. So we are talking about the IVF, the basic concept of IVF. So what are the next stage? I mean, do you have any preparation for the IVF for the couple, and what is the staging of this part? So
Naturally, we have to finalize the causes of infertility. Beforehand, we advise them to go for IVF. I told you the tubal causes, and when the husband has lesser sperm count, we ask them to go for IVF. So we make them prepare by counseling them psychologically and make them understand that the hormones what we use are harmless. Second thing, there are many kinds of hormones are available, you know, highly purified, highly advanced, recombinant way of doing things without harming the reproductive system. So we will counsel them first and ask them to choose the hormonal medicines. After creating the awareness of the process of procedures and protocol of IVF, we make them to undergo IVF. Totally egg retrieval will take 12 to 14 days and then embryo transfer, and ultimately after 15 days we will get the results. Within a month the whole treatment will be over.
Within a month,
yes.
So she become,
yeah,
get the result actually. So there is an said that there is a multiple pregnancies in case of IVF. So do you implant multiple ovum or I mean
embryos
over there.
Just to have a better success rate, people want to have 2 embryos. It is the option of the patients, I mean the couples, rather than we implant more than one. We are happy to give only one, but 1 embryo at a time gives you only 50% success rate. And people who come from other countries like Bangladesh to Chennai, stay out of house for many months, spending for their livelihood, every day, day-to-day life, they have to plan for stay, food, everything. So, the social cost of the whole staying and all is equal to the treatment cost. So, for make the whole treatment protocol shorter, we implant 2 embryos. And if the age is more, we can even, according to the guideline, we can even keep 3, but usually we don't. We keep 2 embryos generally.
Okay, so that's great. What are the advantages of IVF?
Advantages, more success rate, number 1. Second thing, we are choosing the best when they are cultured outside the body. For example, the wife gives us 6 eggs, and we do ICSI, introducing sperm into the oocyte. So, for 1 oocyte, we are introducing 1 sperm, making them pregnant even when the husband count is very less. Even 1 million count, we can make them a parent by using this technique called ICSI, intra-cytoplasmic sperm injection. That is the advanced thing of IVF. It's another kind of procedure what we do. So, by doing this, we culture the embryos until day 5 in the incubators, the latest incubators. We identify the viable ones, that is called blastocyst, and we implant blastocyst, or we do the uterine transfer by making them have better embryo transfer, better normal embryos. So, ultimately the miscarriage rate, the abortion rates are less, success rates are better, and the children who are born out of IVF definitely do better than the normal children.
I want to know 2 advancement in technique regarding the IVF.
Yes.
So, that is, one is your part, that is the blastocyst culture technique that you introduce into the India for the first time. So, and another is the capsule baby.
Capsule baby, the first capsule baby of India was born in 2013 on 28th November, if I am correct. And the advantage is the embryos are not cultured in the incubators, they are cultured in the mother's womb, I mean in the vagina, in a capsule dumbbell shaped plastic device, life oriented plastic, that is called polyvinyl pyrrolidine. We keep them in a small test tube, conical test tube inside the dumbbell shaped equipment device, and after mixing the sperm and the egg, without much incubation, we just keep them inside the womb, just below the womb in the vagina, and they incubate for 3 days. After that, we wash the embryos, put them back into the uterus, make them pregnant.
So, what are the advantages?
Advantages are the incubation is less, use of hormones, medicines are less. So, ultimately it is only 1/3 of the cost of the IVF procedures or treatment. Number 2, they get involved in incubating the embryos. So, socially they get more satisfaction.
Socially satisfactions. And what are the other advancement in the IVF technique?
Yeah, we are culturing the embryos until blastocyst, until they are viable. So, we choose the best, and we give them additional value treatment like laser assisted hatching, make them enabled to hatch out in a proper way, in proper timings inside the womb after the embryo transfer, and we mix them with the protein molecule called hyaluronate, that is colloquially or commercially called as embryo glue, that makes the embryo to get binded to the internal surface called endometrium. They get binded or bonded to the endometrium, and more the facilitation is more for implantation.
মানে অর্থ আমি একটু বাংলায় আমার দর্শকদের জন্য বলছি যে এই যে আইভিএফ এর জন্য যে অ্যাডভান্স টেকনিকটি রয়েছে, যে এর মধ্যে একটি বললেন যে একটি হচ্ছে কালচার টিকার ব্লাস্টোসিস্ট কালচার, যে এটা আসলে যেটি আগে মানে একটি টিস্যু কালচারের মতো, যে এটার মধ্যে রেখে তারপরে সেটাকে ইমপ্ল্যান্ট করা, এটাতে সাকসেস রেট অথবা সফলতার ভাগ অনেকখানি বেশি। এটি একটা
because we are finding out more viability, the success rates are more.
আরেকটি বললেন যেটা লেজার অ্যাসিস্টেড হ্যাচিং অফ দ্য এমব্রিও, তো সেটি দিয়ে আসলে এটাকে আরো মানে সূক্ষ্মভাবে সেটিকে মানে বাছাই করা যাচ্ছে যে হুইচ ওয়ান ইজ দ্য বেস্ট, হুইচ ওয়ান ইজ দ্য
laser assisted hatching, blastocyst and embryo glue all adding the value, giving them best success rate around 70 to 80%.
Embryo glue to হচ্ছে যে এটি যাতে যেটা endometrium যেটা ইউটেরাসের একটি লেয়ার সেখানে যাতে এটি খুব ভালোভাবে এটা
it creates bonds between the embryo and the endometrium.
Miscarriage এর
rate is less.
So এই তিনটি জিনিস কিন্তু এই IVF এর আধুনিক পদ্ধতির সাথে যুক্ত হচ্ছে এবং এটিকে আরো বেশি সফলতার মুখ দেখাচ্ছে। Okay. So do you understand Bengali?
A little.
A little bit. Okay. So how do you feel in Dhaka?
We are always honored, you know, we are very friendly, homely, and people are very good.
Very good. Yes. Okay, that's great. Very nice to meet you. So another, we can go for the another technique. That's you said, if it is the early menopausal lady, if some people, I mean, some ladies are going for early menopause, এবং and they have some accidental loss of their ovary or uterus. So what are the planning for them? How do you make them feel for the parenthood? Right?
Suppose they are in the perimenopausal age, just before menopause, or in the elderly age around 40, their eggs can be picked up after giving bone marrow cells, I mean stem cell treatment, or we call it as PRP, that is platelet rich plasma treatment. And if the number of eggs are in good number, adequate numbers of eggs are obtained after such therapy called cell therapy, that is stem cell therapy.
So stem cell therapy আমি একটু বাংলায় বলছি যে এখানেও কিন্তু এটা ভালো কাজ করছে, মানে it works very good.
And after that we have to subject the embryos for biopsy, that is called pre-implantation genetic test. We take out 4 or 5 cells of the embryo, that is called blastocyst, subject them for analysis, that is karyotypic analysis or genetic analysis, find out whether that particular embryo is normal genetically, and then we can transfer back into the uterus.
That is very important. So any genetic causes,
that is for elder ladies, around menopause they go for IVF. And people who had, as you asked, accidentally lost the ovaries, they do not have any ovarian tissue inside, we can advise them to go for egg donation also. But I don't think countries like Islam countries, people, they don't accept it. So we always go for ethical issues.
Right. Yes. So what about your country, the legislations and
we have got newer legislation recently made, and every 10 years they just improvise the protocols and guidelines for enabling us to do more ethically and make the, you know, it's a kind of responsible reproduction, making the whole countries, the assets of countries are only children, you know, the population. So naturally legislations will be there, regulation acts are there. They regulate us for the third party reproduction like egg donation and surrogacy.
Yeah, we'll talk about it. So we talked about some advancement in the IVF technique. And now we want to talk about the success rate, that people are coming from different areas to you and from your center to your center. So what is the success rate of the advanced technique or advancement of this IVF?
Roughly we can say 100 couples, if they undergo blastocyst culture, laser assisted hatching, along with the embryo glue, the embryo transfer is done, the success rates come around 70 to 80%. I feel that is the highest one we can offer in this, because 20 to 30% of the time, even if we put viable euploid good embryos, the implantation potential of the embryo will be good, but the retaining capacity of the uterus will differ from 1% to 1%. So officially speaking, what exactly we do in the laboratory is culturing only 5 days. After completion of 5 days, 6th day we need to transfer them back into the uterus. If we culture more than 6 days, then it is called embryonic stem cell culture, which is banned in India. All over country, most of the countries, because they go for some other multipotent, totipotent cells. So better to transfer them, or we can freeze them. And if we do frozen embryo transfer, ultimately the success rate is even high.
Yes, that is another option, that you can preserve
freeze them.
embryo, and
surplus embryos are frozen. Yes.
So
that is another advantage for
so how long that
embryo
can be preserved?
Up to 10 years.
10
we have
years.
proven cases. Sibling embryos have been transferred after 9 years, 6 months, and they gave birth recently.
Okay. Recently, we heard that there is a massive evaluation in the IVF, I mean in reproduction in the UK, that the cytoplasmic transfer.
Mitochondrial
I mean, there is a contribution of two ladies, three person for a
totally
single.
three parents for the baby.
So can you can you explain our?
This is called cytoplasmic transfer treatment. Roughly speaking, scientifically we can say there are microorganelles inside the cytoplasm of a cell. A cell has a cytoplasm, outer cover, and a nucleus. Nucleus only carry the maternal genetic material. So the cytoplasm is only helping way to divide the cells, to nourish the nucleus, like that. So instead of having an old cytoplasm for an elderly lady which has less potential to offer a better embryogenesis, they take the cytoplasm of a younger individual, a cell from a younger individual, oocyte, and we take out the cytoplasm of that younger oocyte and we inject into the cytoplasm of the elder lady, and then inject the husband's sperms, make them pregnant. That's how 3 parents for 1 baby.
So that actually
contains mitochondria.
Yeah, that's any mitochondrial diseases.
Yes, that can be done for mitochondrial diseases. And if the old lady wants to retain the nucleus for their generation hereditarily, we can transfer the cytoplasm alone, avoiding the genetic material.
আমি একটু বলছি সুপ্রিয় দর্শক, আমরা আসলে সম্প্রতি শুনলাম ডাক্তার নির্মলার কাছ থেকে যে একটি ইভালুয়েশন যে সাইটোপ্লাজম আমাদের একটি সেলের মধ্যে যে দুটি অংশ থাকে সাইটোপ্লাজম এবং নিউক্লিয়াস, যে 3 জনের প্যারেন্ট বলা যায় যে একটি শিশু জন্ম হয়েছে সম্প্রতি, সেটি হচ্ছে যে তার সাইটোপ্লাজমের যে অংশটুকু মাইটোকন্ড্রিয়া এটাকে সরিয়ে নেওয়া হয়েছে। জেনেটিক ব্যাপারটি কিন্তু রয়েছে মূল যিনি মা রয়েছেন তার, এবং ফাদারের যে স্পার্মটি সেটির মধ্যে পুশ করা হয়েছে বা যেটি বলা হয়, এবং এটি কিন্তু একটি দারুণ অ্যাডভান্সমেন্ট এই আমি বলবো যে এই আইভিএফ এর ক্ষেত্রে। সো ডক্টর নির্মলা, উইল ব্যাক টু দ্য ডিসকাশনস দ্যাট you have a great achievement that 64 years old lady became pregnant. That assisted by you. So how can that possible?
By God's grace,
is menopausal. And
she had donation. Egg donation from her own niece, related to her, related donor has donated. The eggs were obtained from the donor, who is around 28 years old, and the husband's sperms were used. Husband was 74 years old, and we identified the best sperms by certain scientific methods. We choose the best sperm and we injected into the eggs of the donor. The resultant embryos were kept inside the womb of the old lady. That 64 years old lady.
64 years old ladies, her womb is ready for
we made her ready with 3 months of hormonal replacements.
We heard that after menopause it is not
20 years after menopause. She attained menopause at 44 and we did 64. After 20 years, her uterus were made ready. These all come not because we intended to do or we wanted to have a trial on her. Actually, it's the great desire the couple have and approach a doctor.
Exactly. Okay. So, what are the researches actually you did regarding this field?
I mean, we are into stem cell research from 2005. Unfortunately, the embryonic stem cell research, the work was banned. We were in collaboration with the Indian Institute of Science, Bangalore. By now, at present, we are doing the bone marrow stem cell installation for Asherman disease of uterus, where you don't have opportunity of any pregnancy anymore. Those kind of women were helped out by the bone marrow stem cells. And people who have premature ovarian failure, they will have ovaries, but they will not have follicles, I mean antral follicles to produce healthy eggs. So, we inject these stem cells into the ovaries and make them pregnant by their own oocytes.
So,
and the husband also, when they have azoospermia, having normal germ cells, having azoospermia, we can inject these stem cells, make them produce their own sperms.
সো দর্শক, এই স্টিম সেল থেরাপিটি কিন্তু আসলে এক্ষেত্রেও কিন্তু দারুণ রকম সফলতার মুখ দেখাচ্ছে, যে স্টিম সেলগুলো যদি ইউটেরাস এবং যেটা বলছিলেন যিনি এবং স্পার্মের ক্ষেত্রে যদি সেটি ব্যবহার করা হয়, তাহলে কিন্তু অনেক ক্ষেত্রেই তারা সফলতার মুখ দেখছেন। এটি কিন্তু একটি খুব দারুণ একটি অ্যাডভান্সমেন্ট। Dr. Nirmala, so we come back to the last but not the least, that is what are the cost, because people in different categories, they are from low income society, from higher income society people, different multiple people are come to you. So does this cost bearable for them?
Yeah, definitely, because there are various kinds of hormones are available in the market, but still most of the people need only basic hormones like urinary follicle stimulating hormones, like that. You know, capsule baby has only 1/3 of expenditure below 1 lakh rupee, Indian rupee, what I mean. And other IVF therapies can be somewhere around 2 lakhs Indian rupee. We can make it including medications.
Oh, so they can afford it.
And apart from that, they will have some social expenditures and expenditure for other medications other than hormonal medicines, and they are all involved in this whole program. Somewhere around, maybe we can take it as 3 lakhs Indian rupee together with hormonal medicines and medications.
And time duration, you said it's the
no, there are people who come from other countries, they will stay with us minimum 45 days.
45 days. That's good. So what about the after effect? I
treatment.
mean, if
after treatment,
after implantation.
After implantation, so within 15 days we identify them to become pregnant, or no pregnancy also we have to identify within 15 days, and go ahead with the balance embryos the next cycle, frozen embryos we can offer. So once they undergo IVF, they can have twice embryo transfers. They have 2 opportunities to become pregnant, provided we have good number of eggs, I mean embryos.
Okay. So any special follow-up or any medication is required in between the pregnancy period?
Yes, definitely. For about 3 months we need to support the pregnancy. After that, it is as equal as a normal pregnancy.
Normal pregnancy.
Any gynecologist or obstetrician can take care.
Take care.
Yes.
So what are the measure you are taking for the failed couples, I mean, who actually repeatedly failed for the
failure? We do give the frozen embryos. If they fail even on the second time, we have to search for the reasons. You know, when the embryos are viable, uterus are being prepared in a proper way, like how other people are getting treated. If they fail repeatedly, we need to identify the antibodies in their blood, like, you know, systemic lupus erythematosus, kind of connective tissue disorders, autoimmune disorders. We need to identify the reason for failure and then treat the cause and then do the IVF again. Could be done. And during the treatment also, we have certain immunoglobulins we can give them to reduce their immune interference and go ahead with the pregnancy.
Okay, so I have a query about the surrogacy. Yeah, you told initially that surrogate mother also you are practicing in
India. It is easy for Indians, and for other countries they are restricting. You know, restricting.
So what are the laws for the surrogating mother?
Surrogate mother should be less than 45 years, and the mother should be related to the couple. Either mentally or physically. They must be blood relatives or people who are interested in their well-being, you know, neighbors, friends. With proper documentation, they can go ahead by renting their uterus for the couple for 10 months period. They have all legislation, documentation, and a lawyer is involved in this work from the beginning until the delivery.
All right. So what is the advice for the couple who are trying for their baby, who actually trying for the long time, trying for the long time?
So they must all know about the reproductive health, you know, like our brain, like our heart, liver and kidneys. A reproductive system also need good amount of minerals and vitamins, and they need to have good amount of vegetables and fruits in their day-to-day diet plan, and they have to take plenty of water, and all the time they should care about their lifestyle. You know, proper sleep, proper workup, and day-to-day exercise, aerobics or even yoga is okay. Kind of, you know, proper lifestyle, caring the physical entity will bring them timely babies. taking care of that. Like how, you know, after 40 we take care of the heart. You, as a
Yes.
cardiologist, you would have advised so
Right.
many people around, you know, walk for half an hour in the morning. Similarly, when they have a proper lifestyle, caring their physical body, you know, young people, they don't have that system in the education also. That is the
Right.
problem. We have to imbibe such ideas to take care of them first and then go for studies and other employment or whatever the social activities they have to do for the livelihood. Taking care of the body's health is very important. When they have a healthy lifestyle, naturally the reproductive system will be healthy.
Yeah, actually it's the time to
Yeah.
check here.
Yes.
In the
Diet
earlier
plans,
ages,
yes.
right?
They must have proper diet in a proper way.
Proper way.
Yes.
So thank you very much, Dr. Nirmala Sadasivam, for being with us
Yes.
in this studio. And we actually, it's our pleasure to know many things regarding the infertility and its advanced treatment, and nice advices from you for the couples.
Yes.
So I wish you a happy time in staying in Dhaka. So of course we'll see you again.
Thank you so much for the nice interview and the opportunity extended.
সুপ্রিয় দর্শক, আমরা একেবারেই শেষ পর্যায়ে আমরা ডাক্তার নির্মলা সাদাসিবামের কাছ থেকে আজকে জানলাম যে আইভিএফ এর মধ্যেও কিন্তু যে আরও কিছু আধুনিকায়ন হয়েছে, এবং বিশেষ করে আমরা যে ব্লাস্টোসিস কালচার টেকনিক এবং যে এমব্রায়ো গ্লু, এগুলো কিন্তু আসলে আইভিএফ এর যে সফলতার হারকে অনেকগুণে বাড়িয়ে দিয়েছে। একই সঙ্গে আমরা জানলাম যে কতটা সময় লাগতে পারে এই আইভিএফ এর জন্য এবং কতটা খরচ হতে পারে, যেটি সবার সামর্থ্যের মধ্যে রয়েছে কিনা এই বিষয়টি নিয়ে আমরা আলোচনা করেছি। এবং যারা কাপলদের জন্য বা যুগলদের জন্য যে অ্যাডভাইসগুলো, যে আমরা যেরকম সব যত্নগুলো অনেক বয়সে শুরু করি, দেখা যাচ্ছে হার্টের যত্ন, আমাদের হৃৎপিণ্ডের লাংসের যত্ন, অনেক কিছু, কিন্তু আমাদের এই যে রিপ্রোডাক্টিভ হেলথের যত্নটি কিন্তু অনেক আগে থেকে শুরু করতে হয়। এবং এই সন্তানের এই মুখটি আলোকিত, উজ্জ্বল মুখটি, সুন্দর হাসিটি দেখার জন্য কিন্তু আসলেই একটু নিজের প্রতিও কিন্তু যত্ন করা প্রয়োজন। আমাদের সবার কাছে এই আহ্বান থাকবে যে আমাদের এই রিপ্রোডাক্টিভ হেলথটিকে আমরা আরও বেশি সচেতন হই, এবং ইনফার্টিলিটি বা বন্ধ্যাত্বের মতো জায়গাটাকে যাতে আমরা এড়িয়ে যেতে পারি। এবং বন্ধ্যাত্ব যদি হয় তাতে হতাশ হবার কিছু নেই, এর যথাযথ উপযুক্ত আধুনিক চিকিৎসা রয়েছে। আশা করছি যে এতে আমরা সবাই আমরা আমাদের নিজেদেরকে নিয়োজিত করতে পারবো এবং সবাই একজন সফল পিতামাতা হতে পারবে। সবাইকে অসংখ্য ধন্যবাদ।